So we'll start, sir.
Yes.
Right, Jai Jagannath. Namaskar. Happy Saturday evening to all of you. And first of all, I offer my prayers to the Lord for the safety and wellness of all. All stay fit and evergreen forever with lots of positive energy and passion to live happy. Sir, I am Hiranya Mohanty, one of the trustees of Odia Samaj Delhi. On behalf of members of Odia Samaj, extend a warm welcome to all the participants who have joined the session from various parts of the country and abroad. Our keynote speaker of the session, Dr. Prashant Kumar Pradhan, our panelists and experts, Dr. Samrat Kaur, Dr. Rita Bhattacharya, and session moderator of today's webinar, Dr. Lipika Mahapatra. Panel of doctors, ladies and gentlemen, we sincerely appreciate and value and respect your time and presence. It's from 8 p.m. to 9 p.m. for an hour, and we'll conclude it on time. Yes. I'm sure post this session, we all will take away some valuable information and best practices which would equip us to fight and manage the crisis better. Sir, I take this opportunity to introduce briefly Odia Samaj as organization registered as a trust, not for profit, and is primarily meant for promoting the rich heritage, culture, literature, art form, Jagannath Sanskruti of Odisha. Odia Samaj has been successfully implementing its objective by getting the Odia diaspora together in various events and occasions in Delhi and various other cities in the country since 2015, under the patronage and blessings of Sri Dharmendra Pradhan, Honorable Minister of Petroleum and Natural Gas and Steel, Government of India. Sir, you are our pride of all Odia Bhai and Bhoni Manankara, and you are our source of encouragement always. Ladies and gentlemen, the essence of each event and activities organized in the past by Odia Samaj is to celebrate the indomitable spirit of Odisha. So this unique character and personality, indomitable spirit of each Odia and Odia Samaj encouraged us to look out for an opportunity in the time of crisis and COVID pandemic to serve our fellow Odia especially, and the whole mankind general by creating a platform called Odia Samaj COVID Care. So the objective was to provide free telemedicine, free teleconsultation of doctors and counselors, psychologist counselors. Second, to organize wellness sessions so that it helps our patients and other persons how to manage this crisis in COVID. I'm very happy and feeling proud to share that one of our friends in Odia Doctors Fraternity in Delhi, Dr. Ashok Chaudhary, who is instrumental and a moving spirit in supporting Odia Samaj in creating a free telemedicine platform to COVID patients with the help of free access through telemedicine platform Vivio Healthcare. Again, this Vivio Healthcare country head is Mr. Prashant Mohanty, a Odia brother. So he has come forward to give us this technology platform to help us in this managing telemedicine platform free of cost. I also extend our sincere thanks to our panel of doctors who have come voluntarily to support us and give their service selflessly, giving their substantial time in spite of their hard-pressed schedule during this pandemic. Everybody knows how hard-pressed they are. I'm happy to report that till date, in these 5 to 6 days, approximately 150 patients have availed this free teleconsultation facility. And I'm happy to share that almost all patients are recovering from this deadly virus and expressed their satisfaction when asked about the facility. They are very, very satisfied. Facility of this telemedicine is available for all days from 9 a.m. to 9 p.m. and anyone can avail this facility. Apart from this telemedicine activity, Odia Samaj is also organizing the webinar frequently in order to spread awareness related to COVID and also trying to share the best practices to be followed by patients by organizing this wellness session. Hence, we are here today. In this context, we are here today with a topic very much relevant currently. The topic is how to boost self-confidence during isolation, quarantine in COVID. So to take this discussion forward, I invite our mentor, guide, and our president of Odia Samaj, Sri Siddharth Pradhan, to chair the session, and he would ignite the engine to kick off the discussion on the subject. Now over to Sri Siddharth Pradhan, who is a retired IRS officer, a decorated bureaucrat, and a former secretary to Government of India to address his.
नमस्कार जय जगन्नाथ मु बेसी किसी कहवा चाहूनी आमर जो ओडिया समाज कोविड केयर फैसिलिटीज आमे स्टार्ट करिचु आई थिंक वी आर स्टार्टिंग इट स्लोली बट ऑन ए फर्म बेसिस वी हैव ए टू टायर सिस्टम we have panel of doctors who look after the patients in critical cases they are referred to a board of doctors who are very senior professors in different medical colleges. Since couple of days we have started this and we have treated about or they are under treatment about 150 to 200 patients already. And we have gone in a massive way in the social media so that we can give free service. We are giving free services to all the patients over telemedicine. I congratulate Vivio to joining hand with us so that this can go to the length and breadth of the country. There is no caste, creed or barrier. Everybody is welcome to join this platform and take whatever facility is available with us so that we can give it free of cost. Today we have invited Dr. Prashant Kumar Pradhan, an eminent doctor in his own right. He's a professor at the Department of Nuclear Medicine in Sanjay Gandhi Institute of Medical Sciences, Lucknow. We have also invited Dr. Rita Bhattacharjee, a psychologist of repute at Vellore Christian Medical College. We have also invited Dr. Samrat Kaur, again a psychiatrist in Orissa, and Lipika Mahapatra will be moderating this thing. I think I should not stand in the way of the important speakers who have to share their views and generate enthusiasm and also how to boost the self-confidence during the isolation period, quarantine period, COVID time. I welcome all of them and I thank them for sharing their valuable time with us. Thank you.
Thank you so much, sir. Without losing time, with this, I invite our keynote speaker of this session today, Professor Prashant Kumar Pradhan, Professor in Nuclear Medicine, SGPGI Lucknow, to kindly share his personal and professional experience to help all of us during this COVID time. Over to Professor Prashant Kumar Pradhan, please.
Good evening. Thanks for the invitation of Odia Samaj in Delhi. I am really humbled by your invitation. I think I felt that I must contribute something during this COVID-19 besides our professional career where we are completely engaged either actively or passively with the COVID. My whole hospital is now engaged irrespective of the branches, though we are a super specialty hospital in the COVID care. I think from screening to then taking care of the patients, then admitting patients and also, but you know, it is a very simple thing we all must understand. This is an unprecedented virus and this is also an unprecedented disease. That's why mostly uncertain. That's why it is causing anxiety and also depression and distress. Because of this unprecedented nature of the virus and the changing pattern of the virus, that is known as mutation, they say, that is also in the after entering to the host cells of the body, this also can change. All these making our life uncertain and are increasing our anxiousness and distress. And it is quite sudden. That's also another problem which we are facing. But nevertheless, if a tiny virus of 150 micron can almost makes us life horrible, then human beings are quite evolved. And that's, we must adapt to the viral's changing pattern. And this is already exemplified with a virus called influenza. So for a influenza, every year we take a vaccine. So similarly, when such an infection comes, definitely we can also try to make the vaccine changing pattern, which requires a daunting task, but nevertheless it's possible. The most common thing which should you know is how, if a person gets COVID infection, what other things, practical steps one should take one by one. Because these are most anxious. Suddenly you become either a rapid antigen positive or RT-PCR positive. That simple information causes anxiety, both to the patient, even if the patients are asymptomatic. 80% patients are asymptomatic, and another 15% might have mild symptoms, and only 5% will be having severe infection. And I think in psychological or psychiatric term, we must not consider this as a disease. Once you consider it as a disease, there is a general feeling that these persons will be permanently a disease and there will be a sequelae. It's not like that. It's a simple infection, but definitely the cause of uncertainty is how it really changes from the simple mild symptoms to the moderate and the severe difficulty with the COVID, and causing the pneumonia and ultimately causing hypoxia, the less of oxygen and requiring so much of oxygen, so that you must have seen in the news and the print media now. But nevertheless, I think I have a very brief comment to speak, that we should not consider it as a disease, we should consider it as an infection. And because these COVID-19 persons will go on with their jobs and families and loved ones. And we should not define COVID-19 as a disease to basically to reduce the stigma. But nevertheless, these patients or asymptomatic persons have to help themselves. And though they deserve support, compassion, and kindness, in all these informations, because when it suddenly comes, though there are plenty of informations, but still you need a help by opening the communication channel, which is possible digitally nowadays with social messages, with telecare. Though in our country, the home telecare is not so well developed. But nevertheless, this is the time I think the home telecare should be developed. And suddenly migrating to the home telecare is also quite difficult unless until there is a good level of education. But nevertheless, I think with the WhatsApp, social messages, Facebook, many things, the mobile penetration is quite high in our country. And with that, you can get a lot of informations. And, but things which doesn't come really, if you have really powerful information with you, where a patient or patient's high-risk contacts can really adapt to very practical steps of what really has to be done. Once you are positive, that's need to follow. I mean, whether I should take some medicines, whether I should contact the physicians, irrespective of anything, you need to contact a physician through either telecare mostly. And the information should be from a trusted source, because when you just changes from mild to moderate or severe, that's need to be taken care by physicians. That's why we always say that you must seek information updates at specific time of the day. You should not cling to the news and the TV and the print media too much, because that itself will cause anxiety. But nevertheless, we all should gather information at a very regular interval when you are infected or your contacts are in the home. And the home care is possible for only mild disease, very strictly. There is no doubt about it. And we must prevent the spread of infection. That is most important through contact. Or if we have a open space, it is always better. So the closed room where we are and a poorly ventilated room is not the good answer for it. We must have an open ventilated room, well lit, and we must avoid crowded spaces like making a function in a hotel or any auditorium. That will definitely cause a spread of the infection. So that's why you must have seen in the news sometime called the super spreader. These comes from there. I think the more practical aspects we have to observe is how really we go to the home care with COVID-19. We must see that how to do the be in touch with the clinicians. That is only possible digitally, and that where you believe, but nevertheless the clinician has to also have some kind of chat which has to be monitored regularly from the patients, and it has to be minimum from 24 hours to 72 hours, not later than that, unless until you are in continuous touch and monitor their temperatures, their SpO2, their heart rate, and also their general well-being, whether today how he was and tomorrow, yesterday how he was and today how he is, that quantitatively with a scale of 10 or a scale of 100. All these will give confidence to the physician also, so that when he monitors, if the
Hello.
yes, if the SpO2 is less than 94, this is definitely a warning signal. And if the fever is persisting for more than 5 days or 7 days, this is also a warning signal. And also the SpO2, if it is less than. So these are the patients which has to be consulted, and they have to be in the IPD care in the hospital. And that means these are warning signals. And nevertheless, all these things should be followed by monitoring through either the WhatsApp messages or with the telecare. I think if you have the telecare facility, nothing like it, or with Skype or anything. And it is just like going to a clinic. Any telemedicine providing clinic, if you know, then you can adapt to it. There is no problem about that. But monitoring has to be done definitely not later than the 3 days. And we all must know that this infection will definitely continue for sometimes 7 to 10 days. And after 10 days, or after having no fever for more than 3 days, you can start telling that the patient's infectivity will decrease. It has been already shown in the scientific evidence. Coming to the therapeutics, what treatment we are currently taking, like ivermectin or favipiravir, we have discussed many times in our institution, and we realized that the very common medicines for certain patients, for asymptomatic and symptomatic patients, can be tried, like with ivermectin and also with paracetamol. The paracetamol is the best sort. If you have fever more than 100 degree, you must take paracetamol. And this needs to be monitored. And I told you that the monitoring chart has to be sent to the physician on a daily basis, at least every 4 hourly with a stringency, but at least 6 hourly you should monitor that whether you are. And the most critical period is after starts with 5 days to 12 days. This is the period where you should monitor very vigorously and see that the temperature whether decrease or not if the patients. And rest of the things like your infection control, that at home, that you need to with wiping at least once, cleaning the toilet at least once, and the waste management also to when you are there, at least you should take into the polythene, and the mask, hand hygiene frequently with the soap. These are very important. But the major difficulty is whatever the older age group or a fellow which is isolated or a person who has a 1 BHK, 1 room apartment, it is a difficult situations, that's why. Or if a person is alone with COVID infections, alone with the COVID infection, they should go to hospital care actually, because sometimes it will be very difficult if suppose elderly persons of more than 60 years at home and he is alone. I think home care should not be a good policy for them. So these are the things, but nevertheless, the high risk contacts and the patients both should be separated. But in a family, if you have all three people positive, I think you may have each other at least a separate bed, and then you should try to at least you can mix, but you should not sleep with each other. So I think the major difficulty which is coming is monitoring these patients, and monitoring digitally or with a telecare is the best solutions. And or at least if you don't have anything with WhatsApp and phone, but many times the physicians are much engaged. I think it is not, it is always better you should utilize a non-intrusive messaging system rather than talking over phone along, because you don't remember the next moment what they have talked and what that causes more anxiety. So it is better to be documented. And nevertheless, these social WhatsApp messages and all, don't keep the record. That sometimes is difficult actually to monitor, because it is a short infections of for only 10-15 days, and when the number of patients will increase for physicians, this needs to be a standard kind of telecare device. I think with this, thank you very much for patient listening. Anything you query, I will be able to answer, or my panelists will answer. Thank you very much.
So much, sir. Very valid and relevant informations that you shared with regard to the monitoring of the temperature, heartbeat, then the SpO2, and your guidance about the documenting it. It's very, very relevant, sir. And other very relevant input that you gave with regard to toilet cleaning, surface disinfection, and hand wash, waste treatment, very, very relevant, and many other things that you said, sir. So now I hand over this discussion, a panel discussion, to our today's session moderator, Dr. Lipika Mahapatra. So Dr. Lipika is a Bachelor of Ayurvedic Medicine and Surgery, and she's also in clinical research and regulatory affairs. So currently she is working as Ayush Medical Officer in Bhubaneswar. Over to Lipika to take us through a panel discussion, which will add a lot of flavor and a lot of information to the audience. Thank you so much. Over to you.
Thank you very much, sir. I hope I'm audible to all of you. Namaskar, Jai Jagannath. So today's scenario, as all
Ma'am, please unmute yourself.
So we all are facing COVID-19 since almost 1 year over. So right now, today's topic is like we are discussing not about medicine. We are discussing about the mental conditions of the patients and of their relatives and all around us. So the topic is entirely different, and it's a great opportunity for me. And thanks to Dr. Ashok sir for giving me this opportunity to talk to two of the most eminent psychiatrists regarding this subject. And today I feel as if to make it in a lighter form, I would like to say one thing. I remember one movie that is Dear Zindagi of Shah Rukh Khan and Alia Bhatt. आप लोग ने शायद सबने देख रखा होगा. वहाँ पे एक कोट था कि जैसे कि खुल के रो नहीं सकोगे तो खुल के हंसोगे कैसे. So today we are going to discuss about the pain and the sorrows which all the patients are facing right now during this crisis time. So there are few questions from the audience side which we have got. So I'll be asking on behalf of them few questions should I start with Dr. Rita Bhattacharya, Madam, who is HOD Counseling in DIT Vellore. Madam, Namaskar, good evening. I would like to ask the first question to you, Madam. So, hello.
Yes. Can you hear me?
Yeah, I can hear you. Yeah. So am I audible to you, ma'am?
Yes, ma'am.
Yeah. So since we want not just like we say COVID positive हो गया है, लेकिन इसका मतलब negative feelings अपने अंदर नहीं लाना है. We all should have that positivity and that motivation should be there. So my first question will be on that context only. Like we all nowadays, when we hear suddenly that someone of our dear ones is in hospital or there's sudden demise of our dear ones or any known ones. So how to keep oneself motivated, even though we daily keep on getting this news on and off. So how to keep ourselves motivated during this point of time? So can you give certain points for this thing?
Yes, ma'am. First of all, I will say Jai Jagannath to everyone. This is the spirit that we get from a place or from our places. So when we think of this thing, Lord Jagannath is there with us. That is one of the major motivation spirit that comes to us. Well, talking about COVID, I will be talking less of COVID and something more of positive. Because when we consider self-confidence, we consider self-awareness. It is our own self. So when we come to know that there are people who are affected by COVID, who are in demise, whom we know, who are our dear and near ones, first of all, the thing that we have to think is accept it. Because the common thing that is seen in all over the world, sometimes it happens that it is in my family, why me? But now the question is not why me? We all together. So that is what I feel great and my pleasantness to be here to say that we are here together to fight this disease. Yes, this infection. It will not fight and it will not capture us, whereas we will capture them. So the virus that is affected will go one or the other day. There is always a daylight after the night. So we have to remember this. So when we feel that, yes, I understand that when I hear something tragic from others, the first thing that comes is a heartbeat, the raise in heartbeat, the pulse rate, everything goes blank, numb for a second. But first thing what you have to do, immediate therapy is take a deep breath and throw it out. Inhale and exhale. Then think of what is to be taken. Yes, focus on some positive aspects. When you focus on positive aspects, you can tell others about the positive ones, isn't it? Like when we teach our students, we learn the things first, then only we teach them. So when we get motivated, it is a self-motivated we come across. Then we say that, yes. Another thing which it is very important as a psychologist, I will say, listen to them. Whoever speaks to you, listen to them, but don't react. There is always a difference between, reacting and interpreting what you are thinking. So if you react, you will not be the person to help those people, those who need help from you. So after all these things, we will say that keep hope on yourself. Everywhere we see in statistics, in news, and WhatsApp, and social media, everywhere we see that this many people are affected. Why can't we give importance to that, where we can also see that this many people have been recovered? So there is always a chance where there is a negative thing, there is always a positive thing attached to it. This is what is one of the major motivation thing which we have to do. Lend your hands to others. Like as we are here together, we are here to listen to others. We are here to consult with others. There's nothing, no number of hours. Like there was a time when a student was going on calling to me the whole night because he lost his father. He was just a child. He was very much pampered and he was the only son. Within one night, he lost his father. He could not digest. His mother was in the hospital. So the only thing that he was saying that I have lost everything, ma'am, I have lost. But I could only listen to him and I can say that I am with you. In this one word, if you say to the person who is listening to you, that will be a great, great effort for the person there. I was really, surprised to know that other next day, I was in the morning, I could hear him saying that, ma'am, a child has grown to an adult. Now I have to take responsibility of my family, my mother. So this is how examples can be created where we motivate ourselves and we motivate others. So yes, lending people to be positive, to be confident, but never be overconfident. There are people saying that, yes, I have taken 2 doses of vaccine, so nothing is going to happen. If it is going to happen, it is only for mild. No, never.
Very
As
true.
Dr. Prasad sir was saying, every infection, if you have any symptoms, take care of it. You have to take care. Because there were some times, all those times are gone, when we used to sneeze, we used to have fever. But we used to say, चलो चला जाएगा, ये 3 दिन का मामला है, उसके बाद क्या है? लेकिन अभी 3 दिन का मामला नहीं है, अभी कितना दिन होगा वो भी पता नहीं. तो why not we take care of ourselves? एतिकी तो कही परिबी जगन्नाथ महाप्रभु अछंती. That is what a belief, strong belief. And with that name, if you take a deep breath and say that, yes, I am confident, you don't worry, you will be fine too. The positive insert within yourself, the positive motivation within yourself will just drive away all the negative things from you. That is what I could say, ma'am.
Thank you so much, madam. You have already answered another question which was supposed to be asked by one of the audience regarding the vaccine. Thank you so much. My next question will be for Dr. Samrat Kar sir. He is the founder and trustee of the Brain Foundation, and he is an eminent psychiatrist, which we keep on seeing him like in TV and YouTube also. Many of his beautiful videos regarding this boosting up people and making that positivity all around him. And so, sir, namaskar, sir. Am I audible to you, sir?
Yes, yes.
So my first question to you will be, suppose a patient has become positive now. Once a patient has become COVID positive and he comes to know that, yes, I'm positive now. And then his conditions, his mental conditions, he is under stress already. That abhi to COVID ho gaya, ab main kya karu? I mean, that anxiety is always there in the mind of the positive person as well as his family members and his relatives. So, sir, how to deal with that panic situation? Can you just give us few points on this?
Thank you, Lipika madam. So I will thank Odia Samaj for inviting me, because I am in touch with most eminent Odia people all around India, world. So many people are there. Thank you very much. So I would like to share, because this is a Zoom meeting. Let us discuss. If few people are there, so something we should discuss that I'll be more happy. So I'll request host at least unmute as Pradhan sir, Rita madam, or Lipika madam, so that I think Hiranmaya sir, thank you very much. I think Ashok Bhai has some work. But Ashok is not there. I can see many people now. Okay, Sangram sir, Jai Krishna sir. So we can discuss. So I'll take less time, but it should be interactive. So that will be easy for all of us. So my first position is, in this world of negativity, at least we have something that is COVID positive. And why we fear? To this positive factor only. If we were COVID positive, then that is fear. So have you seen any tiger? Have you ever thought about any tiger in childhood? Pradhan sir. Sir.
Yes,
Prashant sir. Okay, sir.
I'm listening.
Have you thought of seeing any tiger? Only question to you. Imagine.
Yeah. Okay.
How do you feel if a tiger will come? Because from since our childhood, we have thought we'll see a tiger. How will you react?
Obviously, the anxiety will come. It will be fearful.
Okay, sir. Then what will you do?
Obviously, I mean, sometimes I get confused what to really do at that moment.
Then
Whatever the reactions will, obviously panic reactions will come.
okay, it will be there. But now, what will you suppose you are in a jungle and Hiranmayak sir will see one tiger? What
Try
will
to
he?
protect myself. How I will not be really harmed by the tiger. So
Okay, sir.
the steps to obviously come subsequently, one after another, quickly.
Thank you, sir. Very nice information. Hiranmayak sir, please unmute yourself.
I will try and escape.
Right. Yes, sir. Thank you very much. So how will you escape?
I will escape I will explore the possibility of means what is available. Either I run, I have to uh, ride get into a big.
Okay, sir. So you'll run. You'll run. You will see a tiger, will run. Sangram sir, how will you deal with Sangram sir? I will not ask you, Sangram sir. Okay. You can unmute yourself. I will request first. At least we are on screen. We can discuss in Zoom meeting. So, sir,
Yeah.
yes. Sir.
So I will scream, and if there will be a tree, I'll climb up to the tree because I don't think I'll run away from the tiger.
You'll run and climb. So you know what to do when you will see a tiger. Because since our childhood, we have read all the books. I don't know, you have read or Sangram sir is looking very young. Janna Mamu has gone through or not, I don't know. But I think Hiranmayak sir, me, Pradhan sir, we have all gone through Janna Mamu in our childhood, not TV days. But you are looking very young. You must have read that Janna Mamu. So when you will see a tiger, you know you will have to run, or you have to jump, or you have to climb. So because you know how much fuel you have, but in case of tiger, there is more negativity. So you will have more stress, there is more chance of death. But in this coronavirus, we know what is the problem. 90% they are recovering only with home isolation. Because you have not since our childhood, what is this virus? We are more fearful, we are more prone to this negativity factor, this less 10%. How do you react? In case of tiger, you'll run, you'll jump. But in this case, we are listening more to TV, more to newspaper, and the negativity factor is coming much more our ways. So, in case of tiger, your grandparents have told you, or we must have imagined, we must have dreamt in our unconscious mind, which controls mostly our mind. I think Rita madam will agree, because unconscious mind is the main factor which controls ourselves. So,
Yes.
in this case, we know how to react, how much we know we'll die or we have to run. But in this case, in our unconscious mind, it is there, more negativity factor is there. People are dying. How many lakh, how many crore, how many millions people they are suffering? How many with only home isolation they are recovering? Without any medication, without any oxygen supply, without any ivermectin, without any medication, they are doing what Pradhan sir have introduced. Those are very good things, but many people all around the world they are recovering without any medication. So we should keep this in mind. when we are thinking about a tiger, about a virus, we think about the positivity. So if a report, I'll say, I had last time I was COVID positive. So it will boost my confidence. Okay, last time I was positive, I could fight. And last time I didn't know how to survive. So in this case, we know if COVID is there, the air, everything around us is negative. We don't have any other problem, but the only thing is COVID is positive, and most of the people they are recovering. So we'll more enforce ourselves, our mind in unconscious thought. We'll think this is a positive thing. Then we will find the negative thing in less magnitude. I think I have answered.
Yeah. Thank you so much, sir. आपण जोड़ा लास्ट को जो प्रकार भाबरे ने जो सुंदर भाबरे बुझेले तरा बहुत ही माने इफेक्टिव ये रहइबो आई थिंक ऑडियंस तांका क्वेश्चन रो आंसर पाइ जाइतिबे so my next question will be for Dr. Rita madam. Like nowadays we all know like we have nuclear families and mostly people live like husband, wife and kids together. So in this condition, how to boost one productivity while confined for days together in four walls? I mean, it is very difficult for the children as well as the parents or the spouse. We see in papers and all also we see many a time we see like there will be a lot of conflicts and there will be tensions in amongst them because previously the husband used to go to work or the wife used to go to work and they were not together in the same four walls for all together for such a long period. So how to boost during this time, how to boost one's productivity? Can you just explain this?
So boosting oneself, yes, it's very important. Like all this type of trauma or this fighting, arguments, took place because one was not giving time for the other. Now, if we take it into a positive thing, we all are together. This is one of the major things which we can learn. Like when the child wakes up, he finds the father is missing or the mother is missing or both are missing and they are being taken care by the maid over there. Now, COVID positive, as Samrat sir has said, positive. We have to take it as positive. It's not COVID negative. So we have to see that all are together. There were times when they used to go for, hilly areas, going for a trip, going for picnics, taking so many photos, making albums and all. This is a time where they can build up a relationship. The relationship bond was missing all these days. And this is what I can say, bringing all together and finding the faults, making into a positive one is the person who is going to make there. So if I say that, yes, the husband is taking care of wife's cooking there and the wife is taking care of the child and both of them sit together and seeing what the child is doing or all are sitting together making some drawing or painting and all, people will be bringing more of positive vibes than the negatives. I just remembered one child talking to me saying that he has grown up now. So he used to say, I have never seen my father after waking up from my bed. But recently he says, I always see my father sitting beside my bed and trying to wake me up. Whether chumutiki uthaivar ba bidiki uthaivar. Bapa ta achanti. That is what a change with the child over there. There has been many years that the relationship was not at all built up. Playing, वो तो साधारण कथा कुहे, जैसे कि play some Ludo or Carom or chess or something which was missing all these years. Do something to see that things are taken care. Some people say that I go to the YouTube channel and see that what can I make for my family. Even some of my students say that, ma'am, I have made this dish and we all sat together to eat. One of the major things which I will say as positive is COVID has brought all of us together. The relationship bonding, sharing each other's responsibilities, that yes, I am there for you. I will tell another thing which can be done as one of the activity, like uh, sitting together, opening the album, and maybe 5 to 6 years or 10 years before the photos you can see, and you just have some laughter. See how you were looking at that time and now how you are looking. So some type of laughter, some smile to bring one among the other can really bring a motivated spirit within you. There are so many things which can be built up, like positive memories. Yes, there were somewhere, like in some picnic spots, we all went together and we had fights. But now we are close friends. You know, when I was talking in my WhatsApp group, we all are school friends coming together or college friends coming together. So I have changed my DP saying that, can you all guess where I was studying, on which class I was studying? So some people says this is, come on, no. So this is type of laughter which we can bring among us. Or we are just trying to develop something positive, like we can learn something new, languages. So where we learn languages, if I learn Spanish, another will learn some French, or another will learn something else, and we can converse among each other. Try to build up something which will bring happiness within us. That is what we are searching for. And we will be landing up beyond COVID positive if we say that we are going to fight against COVID and we are happy. COVID has come to show us that happiness which was lost from us, the relationship which was lost for years together, that smile which was lost for years together. So one of the major point in the 4 worlds, I will say, bring up relationship, bring smile to each other, bring that happiness to each other. That relationship, if you bring, you will really give a salute to COVID positive rather than thinking that why COVID positive in this world. If you take things positive in this way, you will see that, the mind which is attractive COVID positive symptoms, it will just drive it off. Because here in COVID positive, we are not taking care of physical health, but we are taking care of our mental health more. So the mind is what it controls us. But why can't we control the mind and say that, come on, you do whatever I feel like doing. Love yourself, live for yourself. This is what the 4 Worlds Corner will bring you together. Thank you.
Ma'am, thank you so much. But in this context, like this is, they'll be having family. You said like husband, wife, kid. They are together in between that. No one else is there. But then I have another question. Like we do not have the privilege to work from home, but there are a lot of profession like they are doing right now work from home only. So they are facing a lot of loneliness, like they are all alone now. Previously they used to go to office, they used to talk to their friends or their colleagues, but right now they are sitting together at a home and there is always like work from home, and there's some kind of loneliness which they are facing. How to deal with that thing?
Yes, this loneliness comes by itself when we take it. The loneliness when we sit and think why it is going on, why the world is like this. The loneliness comes when we are within ourselves rather than sharing with people. So we can come out of this loneliness. Times are gone when people were not having any media. Now, if I take some smiley photos, okay. So anytime we can take and we can just share it with our WhatsApp group. We have so many groups, right? We have so many relatives. And if the family is not with us, but I have always the family with me in phone calls, video calls, WhatsApp chat. I will just tell you one instance, like it's in my family itself. My sister was all alone last year. She could not come to the family. She could not meet us. So she was all alone in her quarters and the institution was closed. But she used to just relate to us saying that this is what I have done. The creativity which was missing, the hobby, I used to play, I used to dance, I used to do things. Let it come out. What she did, she was just telling me You know, she had beautiful dresses, but she was not able to wear. Obviously, when we sit in one place, we become somewhat fat and chubby. So what she did, she was good at stitching. She just cut aside and she was having a sari fall and she attached to it and she felt that, okay, she could wear the dress. So till now, she is very happy that she could do something for herself. So loneliness is one of the greatest factor how we enjoy ourselves, you know. So loneliness, we can go for guided meditation. We can just sit together, sit with another person also, maybe conference calls and all. Or we can go for mindfulness. You know, mindfulness can take place anywhere nowadays. Mindfulness meditation is not meditation. Even you can just take the pen and you can check what are the things, giving mind towards that particular object and turning it and sensing the pen that you have seen, but some of the aspect you have been missing. Okay, you can just see your mobile, you can just see your laptop, you can just see it in a different way, giving mind to it, you know. So I was just taking a small workshop where I felt like I asked almost all the attendees, let's go for a walk. I mean, the garden was there. So I asked to come back after 5 minutes. So everyone came back. So I told, before telling them to go for a walk, I told all the 5 senses should be taken care. So when they came back, so one told that I could smell the neem tree leaves. It was like this. Some told I could hear the chirping sound of the birds. So many things we miss, but we do it. But here again, I can just say, plant a seed and see it grow every day. Take a snap of the sunrise or the sunset and share it with your family members. There are many things which we can do to make ourselves happy, make others happy. Something creativity we can build up among ourselves and see that we are always engaged. Loneliness will always go if we find engaged and we find happy. I think so somewhere I have answered the question.
Thank you so much, madam. Now, talking on this context only, like as you have said about phones, mobile phones, WhatsApp groups, and we have PC. So these things are available with us to connect to people. Now, sir, on this context itself, I'll be asking my next question to Dr. Samrat Kar, sir. Sir, once a patient is found positive, we always advise him for home isolation. We all are talking about home isolation, about everywhere we are saying no, people should stay at home. It should be isolated for around 17 days. So now in these 17 days, when the patient is isolated entirely from his family, he is staying alone. And then the only best friend he is having with him, or the connection which he is able to connect with the world or with the other people or his near and dear ones, is the phone or the PC. Now, in that case, now as we know, there are many things in media, social media, and TV going on. Like as you said nicely, like 90% of the cases are being coming out nicely, but then only a 10% who are going to they are hospitalized and they are really serious. So, but then in TV and media, it is shown like India's condition is worst, and there's so many things which is very very horrifying. So when we ourselves see, we ourselves also get like impatient. अब क्या होगा, अब तो इस देश का कुछ नहीं हो सकता, अब तो इतने सारे मरने वाले हैं, अगस्त के ये होगा, जून को ये होगा. I mean, these things are there. But when we think of the person who is isolated from everywhere and staying alone, what about his mental conditions? How he is going to tackle these things, sir?
Thank you very much. I have seen many, attended many Zoom meeting, but this audience is very active audience. So I have seen so many messages I was reading. Thank you, Karan Mahapatra sir, Das madam, Abheda madam. But I would like to answer first this question, Sujit Kumar sir. He asked a very important question. Don't you think this overconfidence that will survive have COVID, non-answering, it will making spread more positively? Means if you're overconfident, the problem is just I will answer in 1 minute. See, I am not talking about overconfidence. I am talking about more worried about negative confidence. See, what I have asked, if you see a tiger, you should be confident enough to jump or climb more than the tiger. We know tiger is more powerful than us. So if there will be negativity in your mind, you will not run because tiger will kill me. I think Sangram sir also answered his question. But if you think that negativity is there, you will never run. In your mind, unconscious mind will be there. So now I'll answer your question. When you are isolated, there are many
Hello, sir.
friends of mine asking me this question, and particularly friends. Now they are calling me. So what to do? So, I ask normally any male friend. They are asking for female friend. They are saying, I was worried about my wife. We have conflict, so many things. Or my friend is asking. I'll say, see, this is the time. Your wife will not also disturb you. Your husband will not disturb you. You will be isolated in one room. Nobody will take you or ask you, call you. They will call you, but they will not disturb you. See, you have your own time. See, remember, this pandemic happens in 100 years once. So you are so much lucky you are born in this period. Your parents must not have seen, your grandparents might not have seen, but in 100 years you are going to face this period. So you are isolated from rest of the world. So you have all the time for yourself. See, you are lucky now. What Barita madam told, that technique is called only diversion technique. That is the best technique we have because we have nothing to do. We have to survive, and everything we depends upon the virus and our self-confidence with some medication. So we have nothing to do. We have to only divert our mind. If you think about this thing repeatedly, and please, my request all of you, when a person is suffering from is or COVID positive, don't call him repeatedly and ask what is your oxygen level. That will give him more panic attack. So if a friend of yours is suffering from COVID positive, call him, ask him what food you have taken. Whether food was nice, how was it doing? So what picture movie you have downloaded? Shall I give you some link? So when you think your friends also remember their friends or their family person, they will be in panic attack because of you and they will ask you and call you. Please divert your mind and your when they are asking you, don't go into negative things. Don't ask them, so I am suffering from this. They will ask you, now go and check your oximeter. Problem is that many times the oximeter also sometimes doesn't work. You have to feel your hand, and I think Pradhan sir will answer that how to check your oxygen level. Sometimes it shows negative result. Means oxygen level is high, so you will have panic attack. So your friends will call when you will be isolated. You will ask many people, what will you do? So please, when you are calling your friends, don't ask about COVID, how many are positive, how many they are going to die or they have died. So we just divert our mind. So main gist of Rita madam, what she has told, only diversion technique, dietary left. When you are isolated, remember this is a lucky time. You are gone across, you will not be there much more time. Many of us will survive, but most of us will survive. We have to divert our mind. We'll see, download picture, we can think. I think I have answered.
Thank you so much, sir, for giving this positive message. But then when we think of, for example, this is for the young generation, suppose one young person nowadays, as we are seeing, mostly the young people are getting mostly affected. Suppose the person is of around 25, 26 years of age, or let it be around 30, and he is found positive. So he is isolated. Now, how to handle with the panic situation of the parents? The mental condition of the parents is entirely different. So how to take care of that, sir?
Dr. Lipika will have this last question. We are already short. So with this answer, we'll close. Yeah. Yes, sir.
Okay.
Continue.
Okay, I won't take much more time. Only thing is, you are your best counselor. So neither Rita madam, I think, or me, we are best. So you are our best counselor. So your parents are the best counselor. So here the problem is not the 25 years, 30 years guy. The problem is not with the parents. So parents, they have counseled the child how to become adult. So parents know how to react. So first thing is ventilate. Ventilate your problem. If we discuss this problem and we'll discuss positivity around us, the parents will know our ventilation. You can physically, you may not be, I may be isolated. You can talk by phone. So ventilate your problem. Your parents will take care of you because nobody will be there. You around you in your parents will be there, or you are staying in a flat or apartment. All are here, all same family. Only human race. They are the family. They will take care of us. You should not be worried. Thank you, sir.
Thank you so much, sir. I think with this, we'll close the session. I'll hand over this thing to our next moderator. So with this, we close all the question and answer session. Rest of the questions, if anyone audience is having, they can send their email ID through which our experts will be sending their answers, sir. Thank you so much, sir.
Thank you, Dr. Lipika, for conducting the session so nicely. It went smooth. And we are very, very thankful to our experts, Dr. Samrat Kar, Dr. Rita Bhattacharya. We have taken note of it, very truly said, very relevant, Dr. Samrat, what you talked about. She and also Professor Prashant Pradhan also talked about it, 95%, 90 to 95% patients are recovering. So why not to celebrate this joy of recovery? So everybody should actually celebrate this joy of and the joy of recovery and this happiness. That's the first very good input, sir, you have given. You talked in our last question answer about ventilation. Ventilation is very, very important. Ventilation of communication, communicating your feelings. And in COVID situation, ventilation is also important in terms of ecosystem, the open air and all what Dr. Prashant Pradhan also talked about. Very relevant, sir. And you also talked about the phase of this COVID situation is something which has really given us survival means. So we should really take advantage of that and prevent ourselves getting COVID positive. Dr. Rita Bhattacharya, we have taken lots of input from you. You talked about the Astha in Jagannath. You know, when sadhana works, sadhana, that is prayer works. So Astha should continue because sometimes sadhana fails. So since the infrastructure is not available, people are not getting admitted, bed is not available, oxygen is not available, that's fine. But sadhana and prayer will work and will continue having that Astha in the Lord Jagannath. And you also talked about, digital engagement in the family itself, playing Ludo and family games, that really gives a lot of happiness. You talked about, recollecting, remembering some funny times with friends. Really, it gives a lot of happiness and smile and laughter in the face. You talked about mindfulness, you talked about physical health, mental health condition. All are very, very relevant. There are more questions in the dashboard, but we will take it, compile it, send it across to you so that you can answer these questions to the patients. Dr. Prashant Pradhan, sir, thank you so much. You gave some input which are very, very relevant. You talked about the distinguish between the disease and infection. This is an infection and we should prevent this infection to spread. That's what your herbalism is. And you talked about home care. You talked about monitoring the physical health, temperature, etc. Very relevant that you talked about the home care facility and when isolated, how to take care of yourself. Thank you so much for your so relevant informations and experience sharing to all three of you. And I thank you, Siddharth sir, who is our chair for the session, for being present and motivating us. And I think one thing that I carry is, stay negative to COVID because this is the only negative things in the life that we need to have. And my prayers for all of you to stay negative to COVID so that it gives us energy loaded with all positivity to fight back this deadly virus COVID-19. So with lots of love, care and prayers for all of you, I take the permission of Chair to conclude the session. Jai Jagannath. Namaskar.